Complex or rare diseases. Hypoplastic left heart syndrome is when the left side of the heart is critically underdeveloped. This is a very complex and rare heart defect, so usually not a lot of babies have this defect. This defect means that the right side of the heart must pump blood to the lungs and the rest of the body. Some of the problems that cause this is that the left ventricle is way too small or even non-existent, as you can see in this diagram here. The left aortic valve and the mitral valve don't work properly, and the aorta is smaller than normal. So this artery here. The heart can only function if the ductus arteriosus, which is this opening here, is kept open until surgery. This can be done using medication, but the baby would need a surgery or a heart transplant as soon as possible. Some of the symptoms of this defect are a grayish-blue skin, which is cyanosis, rapid difficult breathing, poor feeding, cold hands and feet, unusually drowsy or inactive, and if the ductus arteriosus closes, shock, which can be conscious or unconscious. And some symptoms of this are cool, clammy skin, which is pale or gray, a rapid, weak pulse, abnormal breathing, dilated pupils, and lackluster eyes that stare. Another symptom, if the ductus arteriosus closes, is death, because the baby's body would not have the nutrients and oxygen it needs to survive. Some of the complications of this defect are that it's fatal without surgery, so there's no way the baby can survive without having surgery or a transplant. And after the surgery, they tire easily after sports. They would have heart rhythm abnormalities, a fluid buildup in the lungs, abdomen, legs, and feet, or edema, formation of blood clots that may lead to pulmonary embolism or stroke, and developmental problems related to the brain and the nervous system. They may also need additional heart surgery or even a heart transplant. Some treatments for this defect are medications, at first to dilate the blood vessels and keep the ductus arteriosus open. You could use breathing assistance, so have a breathing machine or ventilator to help the baby survive until the surgery. Intravenous fluids, which is when the baby would receive fluids through a tube inserted into a vein. A feeding tube, if the baby is not able to feed on its own. Or an atrial septostomy, which enlarges the opening between the atria. Then this allows more blood to flow from the right to the left, so the body can get the blood it needs. The different types of surgery for this defect are, first of all, the Norwood procedure, which is usually done during the first 2 weeks of the child's life. And this is when the surgeon will reconstruct the aorta and connect it directly to the right ventricle. They would also insert a shunt to connect the aorta to the pulmonary arteries, or insert a shunt to connect the right ventricle to the pulmonary arteries. Another option for this procedure is the hybrid procedure, when the surgeon would place a stent in the ductus arteriosus, put bands around the pulmonary arteries, and create an opening between the atria. In the diagram, you can see that the surgeon has patched up the aorta to make it bigger and connected the aorta to the right ventricle, so the right ventricle can pump blood. The surgeon also put a shunt to connect the aorta to the pulmonary arteries, and they connected the right ventricle to the pulmonary arteries, as you can see this one here. However, the baby is still at risk of death due to complications. Later on, another procedure called the bidirectional Glenn procedure is done between 3 and 6 months. This is when you would remove the shunt attached to the pulmonary arteries and connect the superior vena cava to the pulmonary artery. This reduces the work of the right ventricle by allowing it to pump blood mainly to the aorta, and it allows most of the oxygen-poor blood from the body to flow to the lungs without using a pump. Because oxygen-poor blood comes in from the superior vena cava and goes directly into the pulmonary artery to the lungs, and then back in through the pulmonary veins into the left atria, through the opening between the two to the right atria, to the right ventricle, and then out through the aorta to the body. So this means that all the blood returning from the upper body is sent to the lungs, and oxygenated blood pumped to the aorta can supply the organ and tissues with the nutrients it needs. Another procedure, the Fontan procedure, is done between 18 months and 4 years old. This is when the surgeon creates a path for oxygen-poor blood in the inferior vena cava to the pulmonary arteries, and it transports the blood to the lungs. This allows the rest of the oxygen-poor blood from the body to flow to the lungs instead of just oxygen-poor blood from the upper body. So now there is no more mixing of oxygen-rich and poor blood. So all deoxygenated blood from the lower body and the upper body all flow to the pulmonary arteries to go to the lungs, that comes back through the pulmonary veins into the left atrium, into the right atrium, into the right ventricle, and then out through the aorta. Another option is a heart transplant. Because this is a very complex defect, it is sometimes easier to actually just replace the heart instead of trying to fix all the defects. But the problem is it takes a long time to wait for the transplant, and the baby would most likely have to take anti-rejection meds for their entire life.